What should you expect after cataract surgery? Now, I feel like this topic isn't talked about enough. A lot of the discussion is focused on getting ready for the surgery itself, but after the cataract surgery kind of gets left to the side. So there are a lot of patients that go into it thinking, hey, this is going to be great. It's going to be sunshine and rainbows. I'm not going to have to wear glasses anymore. And they're just not maybe prepared for the recovery. And so in this video, we're going to go over minutes to weeks to months, the good, the bad, and the uncommon warning signs that you should be aware of so that you're prepared for the recovery of cataract surgery. Let's focus in. So starting off with the surgery is amazing. It takes 15 to 20 minutes maybe to complete the surgery, and sometimes you don't even realize that it's done like that, and it is amazing. Now, after the surgery, you do need to expect that your vision will likely be blurry. You'll probably have a little bit light sensitivity. Your eyes will be dilated, and this dilation can last the rest of the day, sometimes 2 days. Now, because of the surgery, you will have some swelling, inflammation, irritation, and so you'll have this gritty, sandy feeling, sometimes a foreign body sensation, and this is all completely normal and common and pretty much expected to have. Usually that first day or the first 2 days, you'll have an eye shield. This is just to protect the eye from you accidentally scratching or rubbing the eye, and this can be uncomfortable and kind of awkward to wear, but very important that you keep that eye shield on. And likely the patient already knows this because they should have told them, but you will not be driving. You will need a driver to go home because you will not be cleared for driving until the doctor knows that you can see appropriately on the vision chart. Usually they start just by doing the surgery on one eye, and a week later they'll do it on the second eye. Now, at the 1-day follow-up, a lot of times people do see really well, and this sometimes gives you the wow factor because they'll take that shield off, or sometimes you're already noticing that, hey, my vision is doing really well, and you'll see great on the vision chart. Now, it is also common to feel like your vision is still blurry. Sometimes the dilation is still wearing off. You still have a lot of swelling and inflammation there. So the vision can still look blurry and foggy, especially at nighttime. And so don't be scared by that because this is considered normal. In fact, in those first days up to weeks, it is still considered normal for your vision to have blur to it. It can have fluctuating blur as the eye is healing. Light sensitivity is also considered common because you're getting a lot more light into that eye because the cataract is gone. You can think of the cataract as maybe a little bit of a yellow tinted sunglass that was blocking light. Now that sunglass is gone, and so you're getting extra light into that eye. So the first few days, because there's a lot of inflammation and more light, you might be extra light sensitive with the blur. And the other thing that's common to notice in those few days is you might notice more glare and halos at nighttime. This is considered a positive dysphotopsia. You'll get this glare because you have some swelling in the cornea, the light's being bounced weird. You'll get some halos as the eye is kind of adapting to the new lens and optics in there. And this is all considered normal and usually gets better as the weeks to come. One thing to expect in that first week, if you did just have one eye done and you're waiting a week to get the other eye done, that week in between can be a little weird. Not only is one eye not have the cataract in there, so colors might be different, the vision might be clearer, but you have the other eye that might still need your normal glasses prescription, and the colors are different in that eye, and so you can pretty much expect your depth perception to be a little off. Going up and down stairs, holding onto railings, walking over curbs can be a little weird, and so you definitely want to be more careful in that week in between. A common thing that a lot of people do, if you do wear glasses, your eye doctor might recommend or say, hey, you know what, let's just pop out that lens you just had the cataract surgery in and still wear the glasses so the other eye can see clearly or see the clearest it can, and the other eye doesn't have an old prescription in it. That might help with the depth perception. Now, sometimes this doesn't work depending on the difference between the two eyes, and so that can be weird, and you'll definitely want to discuss it with your doctor. Now's a good time to talk about the drops. You will be married to your eye drops for at least a few weeks. Now, there's usually a steroid anti-inflammatory eye drop that you'll be using. That's usually the drop that you'll use the longest. And then there is an antibiotic drop that you'll use, and sometimes a type of pain aspirin type of eye drop. Now expect to use these drops frequently over the next few weeks. You're going to have some inflammation that you need to control. You want to make sure your eye's not going to get an infection. And along with those drops, you'll use artificial tears to help with the irritation and dryness. And yes, the irritation, redness, foreign body sensation, gritty feeling can likely still be there after the surgery for a few weeks. And this can be from the swelling, the inflammation, and sometimes the eye drops themselves, the medication eye drops, will cause the surface of the eye to be irritated. And on top of that, the cataract surgery itself can disrupt the tear film and tear production, where your eyes tend to be a little bit more dry after cataract surgery, so that is really common. If you want to learn more about dryness after cataract surgery, I did a whole video and interview with one of the top ophthalmologists about that, and I'll put the link in the description below. Now, as far as normal activities, those first few days, it's recommended to avoid any heavy lifting or bending over, just to kind of give your eyes a chance to heal up, and it doesn't cause any pressure changes within the eye. Then up to 2 to 4 weeks, it's usually recommended not to be swimming or exercising, lifting something really heavy. And so you just want to wait for your doctor to give you the green light on those. The other thing that I wanted to know, one thing that can be fairly not uncommon, is a subconjunctival hemorrhage. Sometimes the surgery itself can cause a little pop blood vessel in the white part of your eye. Now this can look very scary and very concerning, but if it's a subconjunctival hemorrhage, it's pretty much just kind of an eye bruise and will heal up within a few days to a few weeks, depending on the size of the bleed. Again, can be common. Your eye doctor will look at it, but most of the time the doctor will say, this is no big deal. It's going to look scary, but it's not threatening at all. I did a video about this as well if you wanted to check that out. Now, I briefly mentioned this really quick, but likely colors will look more vivid and intense. The blue sky will look more blue. Your white walls will look more white. And then this is something that's really common and something that is really noticeable when you have the first eye done and you're waiting that week for the second eye. A lot of people will sometimes compare the two eyes just by looking at the colors of different things. Again, like I said, cataracts is kind of like having a little bit of a yellowish tint sunglasses on your eyes all of the time, and then all of a sudden taking that yellow tint off. That yellow tint was causing the white walls to maybe look a little bit of yellow and taking away a little bit of the blue sky. And so that is something that can be sometimes overwhelming for some people. In fact, it takes a little bit while for the brain and the eyes to adapt to that new type of vision. And that might be the takeaway message, is within the minutes, days, weeks, first month, while your eyes are healing, the inflammation is going down, there is an adaptation process that your brain and your eyes are going through. The brain is not used to the colors that you're seeing, the amount of light that's getting into the eyes, how the eyes are focusing light, because it does have a new lens implant in there. And so the brain is adapting. So that first month is a little weird. Usually your vision is much better, but there is an adaptation process for sure. Now, as far as going into your eye doctor for follow-ups, like I said, there's that 1 day post-op follow-up. There's usually a 1 week post-op follow-up, and then usually a 1 month post-op follow-up. Now, at the 1 month mark, that is where most people seem to have stabilized. Maybe the fluctuating vision has stabilized, the swelling and the inflammation has gone down, the prescription, the glasses prescription has stabilized, and that's usually where a lot of people can finalize their glasses prescription and get glasses again. Now, that news might be extremely bad news for a lot of people. So yeah, that's right. I said maybe get glasses again. Now, after cataract surgery, there are a lot of people that say, ooh, I'm not going to need glasses anymore. But when you get that lens implant, usually it's a monofocal lens, meaning that it's set for distance or near. Most people, they set their lens, their vision for distance, and they'll still need reading glasses to focus on things up close. Now, a lot of times for most people, they can go pick up reading glasses at their local store and be able to read just fine up close, or at least get them by while their eyes are healing. And at that month mark, they can get their prescription set of glasses to make it more fine-tuned and more customized for them. Also, there are some people that might have some residual astigmatism depending on the type of lens implant that they have. If they've had astigmatism before the cataract surgery and they choose to get a lens that does not correct the astigmatism, then likely they're going to still have astigmatism after the surgery. and they'll have a glasses prescription that can correct for that and improve their vision even better. So again, just to recap, normal to feel foreign body sensation, irritation, dry eyes, gritty feeling, going to be using a lot of eye drops, and it's normal to have light sensitivity, some blur, fluctuating blur, some glare, and halos. That is all considered normal. Now, what is not normal? Extreme blur or sudden drops off of visual acuity. So if you feel like maybe the vision has been great and all of a sudden you have a day where it is really bad and going downhill. So meaning by day, your vision is getting worse. That's not normal. It should be getting better and better. Now, again, you will have some fluctuation there, but if you have a sudden drop off and it keeps going, you definitely want to get in and check with your eye doctor. If you have severe pain, that is not normal. Again, it's normal to have some irritation, maybe a dull ache. That is considered kind of a normal recovering from surgery, but severe pain, having a hard time with lights causing severe pain, then you want to go into your eye doctor. If you have mucus, maybe there's a sign of an infection, the redness is getting worse and worse, go into your eye doctor, not normal. Usually your eye doctor will check your eye pressure. It can be somewhat not uncommon for your eye pressure to spike up a little bit right after eye surgery, right after cataract surgery, and so they will check that because they have ways of lowering the eye pressure. Some people can have a side effect from the anti-inflammatory eye drop, the steroid eye drop, causing an eye pressure spike. And so it's important to go to those follow-ups because if your pressure is high, then an eye doctor will want to lower those eye pressures so it doesn't do any damage to the inside of your eye. It can be somewhat normal to have floaters, but even then, with new floaters, you want to tell your eye doctor about it so they can check every part of your retina to make sure everything's okay. When in doubt, if it's weeks or months after your surgery, don't hesitate to call your eye doctor to have them check everything out. I think the eye doctor would rather check everything, make sure everything's fine, make sure everything's normal, rather than have something bad happen. Now, one other thing to be aware of, sometimes months after surgery, you can feel like maybe your vision all of a sudden starts to get blurry again or cloudy. It feels like the cataract is coming back. Is that possible? While it's not possible for your cataract to come back, there is something called a secondary cataract, or a side effect from having the cataract surgery that gives the same type of symptoms as what a cataract would do. And this is called a posterior capsular opacification. Can be fairly common in about 20% of the people that have had cataract surgery, but can be easy to fix. And if you want to learn more about that, because it can be common, I did a full video on that. Check it out right here, and I'll put the link in the description. Hey, if you've had cataract surgery, let me know how yours went. Did you have any weird symptoms? And do you have any questions if you're about to get cataract surgery? Let me know. Stay focused.